So my name is Miguel Martinez. I am a sixth-year political science student here at Duke. My research largely focuses on how Mexican immigrants get socialized in the way to think about race and racism, both starting in Mexico and how that's either transformed or formed once they immigrate to the U.S. And we are excited about this panel, and so I'm going to pass it on to Elizabeth so she can introduce herself.
Thanks, Miguel. I'm Elizabeth Brown. I'm a seventh-year doctoral student in the Department of Art History, and Visual Studies, and I'm writing my dissertation on a Chicago-based artist named Theaster Gates and his collaborative participatory art practice.
So the title of the panel today is called A Collaborative Approach to Addressing Food Insecurity in Durham's Hispanic Latinx Community in the Age of COVID. But before I kind of get started on this brief presentation, I do want to take time to have our wonderful panelists to introduce themselves. And so if you could just tell us your name, what organization you represent, your specific role in the organization, and perhaps the responsibility you have in regards to this collaboration.
Hi folks, good afternoon. I'm Scott Esco-Brummel, and I am one of the co-managers for the Fresh Produce Program underneath Root Causes. For my day job, I work here at Duke in the Initiative for Science and Society, but I've been kind of advising and volunteering with Root Causes since 2020. And yeah, that's about me.
Hello everyone, my name is Ruby Morales and I'm the Community Health Department Manager at the Centro Hispano, and we are a non-profit organization and we work with the Latino community in Durham County for more than 30 years now.
Hi everybody, my name is Saskia Corns. I'm currently the Program Director at the Duke Campus Farm. We are a 1-acre working farm about 10 minutes from here, owned and operated by Duke University. I played a bunch of different roles in that organization since 2015, and maybe most germane to this panel, I was a farm manager at the Duke Campus Farm when the Fresh Produce Program started. And I also teach in the environmental humanities at the Franklin Humanities Institute here at Duke.
Good afternoon, everyone. My name is Elaijah Lapay. I am an undergraduate senior here at Duke University. I'm studying an individualized degree program called Migrant Health and Healthcare Access and Application. A lot of that has been tied to my work as the research director for the Root Causes Fresh Produce Program and overseeing a lot of our research and quality improvement efforts since the beginning of the pandemic and our transition to our current model that we'll be talking about shortly. I also, through this work and related work, engage with the community through Lincoln Community Health Center, of which I am a resource community navigator for the pediatrics department.
Thank you all. So we're really excited about this panel because a lot of the themes that we talked about earlier today on the earlier panels about trust, compensation, or in terms of specifically how to engage with the community, how collaborations start and evolve is something that we really want to highlight through this panel. And so we're really excited about getting all their input and really just seeing how these themes kind of exist in the community aspect of community engaged research specifically. And so before we start asking panelists a few questions and opening it up to you all, we want to just provide some contextual foundation on what the topic is today, and that's specifically on food insecurity in Durham. And so I'm just going to present a brief overview of what we're talking about, and then we're just going to get into questions. And so since we're talking about food insecurity, what exactly is food insecurity? And so food insecurity is the lack of consistent access to affordable, nutritious food for every person in the household to live an active, healthy life. And these things kind of can exist in a spectrum. It could be people eating lower quality food or perhaps skipping meals entirely. And so just to put this in perspective, more than 44 million people, including 13 million children, experience food insecurity in the U.S. And at the state level here in North Carolina is the eighth highest rate of food insecurity, the eighth highest rate of food insecurity in the nation, with 630,000 North Carolina households who identify as not having enough to eat. And so here in Durham and surrounding counties, Roughly 78,000 individuals live in food insecure households in Durham. And so this is to illustrate the fact that food insecurity is a very big issue. It's not only a local issue, but a nation issue, a global issue. And we're just happy that we have panelists who are really seeking to address this. And so why, in thinking about food insecurity, there's obviously some consequences when someone is experiencing this. And more specifically, we know that food insecurity can cause serious health issues, right? Higher rates of chronic illnesses such as diabetes and obesity. It can affect children's ability to learn and grow, affects their academic achievement rates. It can also lead people to make difficult decisions between food, rent, paying for transportation, and different bills, and obviously has a mental and physical toll on people experiencing these things. And so food insecurity is very multifaceted, has different sources and roots to it, and also can also be a root in other issues in people's lives as well. And so more specifically on this panel, we're talking about food insecurity in the age of COVID. And so when COVID happened in 2020, food insecurity rates jumped. In 2014, it was about 23%, and in 2020, it rose to 31%. And so it was a drastic change. And for our public health folks here and other folks who work on inequity, we know that health disparities are primarily driven by social inequities. And so when COVID happened, households who already had fewer financial, social health health resources to sustain themselves during the pandemic were particularly hit the hardest. And this is evident by the fact that in the Carolina Cross 100 Community Listening Survey, food insecurity was among the top 5 issues people identified as having worsened during COVID-19. In particular, Latinx and Hispanic communities were particularly hit the hardest. Compared to white non-Hispanics, food insecurity is double that in the Hispanic community. And so this is obviously a major issue that has severe consequences on people experiencing it. And so what we want to do is just highlight the people who are really seeking to address this issue. And so we're really excited to have all our panelists here to really talk about the work they're doing. And so I'm going to pass it over to Scott to kind of explain how this collaboration functions.
Thanks, Miguel. So yeah, just to kind of start and provide some framework for how our collaboration works, I'll first explain how the Root Causes Fresh Produce program first came about, and then quickly kind of catch you up with how we operate now. So Root Causes started out as a medical school student organization here at Duke University. It was founded by students who were really forward-thinking in wanting to include social determinants of health, the non-biological aspects of people's healthcare, into their education and their practice as young physicians. They wanted to include that as part of the education. They also wanted to be able to do something about it. So through some fundraising and advocacy, they started to encourage the physicians that they were training under to include food insecurity as a part of a normal check-in with the patients. And then on top of that, they were also able to bring in food to one of the clinics here and provide that food to patients that were identified as food insecure, so that something was actually being done there. And we've kind of continued that model of really advocating for social determinants of health, of being a part of how Duke sees health, and kind of being at the forefront of how it's going to do it, especially with respect to food insecurity, but also some of the other social determinants like housing security, safe and walkable streets that other peers and under Root Causes are addressing. So I said that we started by having food in the clinic, and that kind of operated from about 2017 to the beginning of the pandemic, when we were seeing about 30 patients a month. With the pandemic, there's kind of a complex of things that came together. Obviously, the need increased, as Miguel had shared, but also the support, not only with funding, but also the outpouring of the community. I'll explain a little bit about that outpouring, but just to explain how we operate now and how we kind of adapted because of the pandemic, we went from a clinic-based model to a distribution model, very similar to Meals on Wheels or what you can imagine with Amazon, where we purchase food, or we'll start with the graphic here. So we work with healthcare partners, and now we have about 13 referring clinics and over 50 referring healthcare workers throughout the Duke Health Network and some of the surrounding clinics outside of the Duke Health Network that know that they can include food security as a part of their screening with the families that they're seeing, and then refer them over to our services. We work with volunteers from the community, including students, to build relationships with those referred patients, get them onboarded onto our program and explain what it is that we offer. And then we work with local partners to source food, either through funding that they provide us or through food that we purchase. We work with a nonprofit called Farmer Food Share that prioritizes purchasing produce from small-scale minority-owned farmers across the state. And they bring that to market here in Durham, and we're able to use their building and purchase that local produce from them. And then work with volunteers to package the food, and then along with the food that we're packaging, which is produce, also include educational materials that are sourced from our local community partners, as well as students here. So it includes information about social benefits, recipes related to the produce that we're providing, and other kinds of local information. And this information is aggregated and translated through some partnerships that we have here at the university with the assistance of the Spanish Service Learning Department. Hey, Joan. And so we think about making sure that these resources are bilingual. And then we also work with community members to put the food into vehicles and deliver it to our patients' homes. So in a nutshell, what a family experiences as a part of our program is ongoing relationship with our organization, where we are constantly calling them at least once a month and providing food deliveries to their home every other week. And we currently have a patient population, or not patients, they're participants. We have a participant pool of about 400 families that we're actively serving. And with this support and that outpouring of community volunteering, we've been able to operate for 187 weeks in a row, which is exciting. If you think about where you were 187 weeks ago, we have not missed a single week, and it's been really incredible that we've been able to do this with that support. And there's a lot of development that we have ahead of us, and Elaijah and the rest of our panel here will be explaining that. But because of that support that we had from the community, we have at least a reputation of being dependable and consistent out there in the community that allows us to be able to build and develop the services that we're providing.
A quick follow-up question. Thanks, Scott. So Miguel and I really liked this pipeline illustration, if you will, because we thought it visualized this collaboration that we're trying to really deep dive into today. But I was just wondering, and Scott, thank you so much for explaining those various parts. But for the rest of the panelists, could you actually describe or tell us where you all fit into those little circles? And I'm sure that there's some overlap, but if we could kind of point that out for the audience, where everyone kind of lives in this illustration.
Well, as El Centro Hispano, we represent the community, so we are on the circle where we were receiving many calls of the community doesn't have food for the week, so we start looking for partners who can help us provide or where we can refer them, and they are culturally appropriate for them, and that's when we connect with root causes, and that's how this work starts.
Duke Campus Farm is in the local partnerships supply food bubble. We are currently donating about a quarter of what we grow directly to root causes, and are really grateful for their partnership in getting this food out into the community in a spirit of accompaniment. It's one of the reasons why we love working with y'all.
And I guess if you're talking about me personally, I feel like I've been in all of these bubbles at some point during my time. I really started as a volunteer myself, developing some of these relationships and calling in English and Spanish. And then from that point, really have taken a role in developing relationships with healthcare providers through my time at Lincoln, for example, developing and understanding our partnerships in sourcing food with the Duke Campus Farm and our other partners. Working to make sure that we have consistent and appropriately sourced and translated nutrition education, and then actually the operations delivery and everything sort of in between. So, yeah.
And I'll just kind of add how root causes and El Centro kind of initially got connected, at least after the pandemic, or during the pandemic, I should say, is through something that the county has been really good about in bringing together organizations and researchers that are interested in food insecurity and hosting, during the pandemic at least, it was bi-weekly Zoom calls to kind of bring everyone together and figure out, how can the community share its resources to better understand the needs of our community and then address those. And it was through these ongoing calls that I got to meet some of Ruby's colleagues and kind of learn about the outreach that El Centro was doing in the community. They learned a bit about our delivery system, and it just happened to be that there was some funding that you all received to provide food deliveries to quarantining families. We kind of had a model to be able to facilitate those sort of deliveries. We also had a need ourselves of having a giant vehicle to be able to pick up food that was donated to us, which El Centro had available for us to use. And so that was kind of the start of our relationship. And then beyond providing food to these quarantining families, often we would have excess produce or would make arrangements to have produce available at El Centro's outreach events.
And Ruby, would you mind, as a follow-up on from the El Centro perspective, when the COVID first hit, how that kind of community, the community reached out to El Centro, and just a bit more about, from your perspective, about that?
We can just realize we got 3.
Okay, yeah, well, when the pandemic first hit and we start receiving those many calls of community members don't know what to do at the first, especially because the Latino community was really impacted by the virus. So we were trying to connect them with resources, but then we had to bring up our team of promotores, the CHW, that were out there in the community educating them, and also like bringing more information and really like hearing what their needs. And that's when we find out they're not stopping work, so they have to go to work every day, and if they don't go to work, then they're gonna miss money from their week. So that was a really tough time for us, and we didn't have the capacity to like how to respond to this, because everyone was so new and so impacting for everyone. So we tried to connect with different agencies and bring information, and then we try to do food distribution, because that's the first thing that we thought, okay, if they're needing food, we're gonna bring them to them. So that's what we started doing, so this food distribution. And later on, when the vaccines were out and the community also was afraid to come to the vaccine clinics to get their shots, well, something that we made them incentive for them to come was to bring food into those distribution. And that's when Root Causes was providing us with food for them. So the community, we were like kind of win-win, because we have our community vaccinated and protected, and also as well, they have this food need covered as well.
Thank you, Ruby. This question's for Saskia. So I'm just curious to know if you could just tell everyone, how did Duke Campus Farm hear about the Fresh Produce Program, and why did you all decide to get involved?
So this was actually slightly before my time, in March of 2014, when the Duke Campus Farm was essentially still a student-run organization. We hosted an alternative spring break program that focused on food insecurity in Durham. And that break program included activities like gleaning sweet potatoes with the Society of St. Andrews, delivery of food through Meals on Wheels, a dinner prepared by students consisting entirely of ingredients that were salvaged from a dumpster, and also a series of conversations about the limitations of these efforts. And in that cohort was a very enthusiastic undergraduate junior by the name of Julian Z, who stayed in touch with the program following that participation in Alternative Fall Break. And so when he came back to us around, I guess, the winter of 2016, saying that he had this new idea for a food distribution program and asked for donations, it was an obvious yes. I think not myself, but my former colleague, Emily McGinty, participated in a lot of early kind of dinner table type conversations with a lot of students with laptops, trying to figure out how to solve some of these problems. And both of our programs, I think, have grown and evolved a lot from there.
Yeah. I'm curious to hear more or hear from Elaijah. So organizations like Root Causes and more specifically their Fresh Produce program cannot run without its volunteers and local partnerships with institutions like Duke. And so here I'm thinking specifically here of the 2020-2021 Basque Connections course, improving food security and to increase resiliency to COVID-19 for Latinx populations. So I'm curious, Elaijah, can you tell us more about this project, what you all did to play an important role in tackling food insecurity in Durham and the Durham Hispanic community during COVID, and why you decided to join the project and why you continue to be involved?
Yeah, thank you for asking about it. So for those unfamiliar with Basque Connections as a program, it is essentially a grant-funded opportunity for faculty to create interdisciplinary projects that in turn allow for students to engage in real-world activities and research opportunities co-directed with faculty. And this came at a very interesting time in conversation with all of the other things going on, not independently, but in conversation, and specifically members of the Root Causes Fresh Produce Program research team prior to my time, Alana Horowitz, Hannah Malian, in particular, and Katerina Martinez, they were particularly instrumental in creating a team specifically addressing this question of food security in the Latino community in COVID. And it's worth noting that prior to the pandemic and prior to really the current delivery model that is currently what is known for the Fresh Produce Program, there were very little to few Hispanic identifying people enrolled in the Fresh Produce Program. That was due to the Duke Outpatient Clinic and their patient population. The reality is they don't see a high volume of individuals who that primarily use Spanish as their language of communication or just generally identifying as Hispanic and Latino. And that was an identified health disparity, specifically by a primary care doctor that was really instrumental in doing a lot of things for the Latino community in this space, Dr. Viviana Martinez Bianchi. And so in combination with that physician and those graduate students at the time, they developed this Basque Connections program, or Basque Connections course, in order to develop a mechanism to actually formally feel confident as a program that Hispanic and Latino identifying people, primarily those who preferred Spanish as their language of communication, could be in the Fresh Produce Program, and that would not be a concern of equity. And so that program led to the beginnings of people on the team, not just coincidentally, but intentionally having Spanish language capabilities, people who were mindful and thinking about how could we actually include members of the Latino community, and most importantly, conducting specific outreach toward identifying members of the Latino community from both the Duke Outpatient Clinic and more generally within Duke's patient population, for example, Dr. Viviana Martinez Bianchi's personal patients, into formally the Fresh Produce Program. So that Basque Connections class in its inception was intended to think about how to do that support and also think about how other programs in the triangle were also doing or not doing that sort of advocacy and intentional inclusion of Hispanic and Latino community members. And so hopefully that sort of answers your question about where this sort of came from. That existed for 1 year. That's how I first got involved with the Fresh Produce Program my first year at Duke. At that time, I was not as good at the Spanish language as I am now, but through that participation was my mechanism to get involved with the Fresh Produce Program and continue in particular with our research and quality improvement efforts and being intentional in thinking long-term beyond this program. How do we actually conduct and continue this work with the Hispanic Latino community? That was what led to a lot of the first conversations with Spanish service learning, and also a lot of the first conversations in really thinking about how do we structure a program that can, in the long term, do this work and have these partnerships with El Centro Hispano, for example. So.
Thanks, Elaijah. Just to follow up, though, could you just tell us a little bit about why you continue on with this work in this particular project?
Yeah, so for myself, I think this is something that for me is really important, or I've come to recognize as very important in this work. I myself come from a family of immigrants, and while I have had the privilege in this country as a child of immigrants to not have similar sort of concerns about food security in my own life, as I have come to Duke and have studied this field and this work, it's become a very personally impactful and emotional thing. When I think about what it means for me to be in these spaces, the reality is, even now, there are not a lot of people who look like me. I think we as a program ourselves are still trying to figure out how to be intentional about who are the faces of food insecurity in this community. And the reality is, when working with some of the partners that we do and thinking about how we represent ourselves in the community, it is not uncommon for me and very few other people to be the only ones who speak Spanish, to be the only people, not necessarily the only people who speak Spanish, the only people willing to start conversations in Spanish and start the conversation with people. And that is something that I think is influenced from my own immigrant background and feeling comfortable and willing to use language as a bridge when other students who have only engaged with different languages from an academic setting are still broaching that comfortability. And so for me, that has been the impact of this program, and also more widely what it's meant for me as somebody who's studying immigration and health. The role that even being able to say hola, muy buenos dias, or muy buenas tardes, and actually feeling like you can have that conversation with people is, I think, widely discounted when we think about research and thinking about what it means to be able to be a part of community. And so that's why I stay on, not just to develop my Spanish, although that's been a really good secondary benefit from that, but also being able to feel like, I genuinely personally feel like there are people who would not choose to continue engaging with the fresh produce program and with root causes were it not for somebody there to speak Spanish to them, and somebody who they could at the very least feel like there was somebody who looks like them, even though I'm not Latino. It's a complex process that I think each of us have had to reckon with our own ways, and that's just a slice of my perspective into that matter and why I keep on doing this work.
Thanks so much, Elaijah. So now that we've kind of discussed how the collaboration came about, Scott gave us a bit of a background about the initial formation of Root Causes as a student-run program, and then how in COVID, the Fresh Produce program and got linked up with El Centro, and also Saskia, how Duke Campus Farm came involved, and also Duke Campus Farm is a student-run organization itself, so that's a whole different panel about these amazing students who are doing organizations like this. But let's move on to how this collaboration functions. So this question is open to all the panelists, and just wondering, it might seem, I don't know, it might seem to some people that this is a kind of a straightforward collaboration and how it all works, but I'm sure that there are a lot of challenges in the daily operationals or how the collaboration collaborates. So if you could, kind of give us some insight into some of the challenges that this collaboration that you all face.
Well, maybe one place that we can start, and Elaijah, I'll pass it back to you again. I think it would be great to share about our most recent collaboration with the CTSI-funded study that we did with El Centro. If you want to provide just a quick overview of that, and then maybe we can use that as a platform to talk about some of the challenges and lessons learned.
Yeah, sure. So thank you for mentioning that. So I can talk a little about where that came from more broadly, and then provide Scott and Ruby to maybe give sort of on the ground what that actually kind of panned out, although I feel like we could all talk about that. So We work with a primary care doctor in general internal medicine, Dr. Patrick Hemming. And as a part of our collaboration with him, he's really the root causes faculty advisor. And as a part of our partnership with him, we became aware of a funding opportunity with Duke's Clinical Translational Science Institute, as Scott mentioned, and specifically their Population Health Improvement Awards program, in which there's an opportunity for funding for specific community engaged research projects engaged with a Duke faculty and a community partner. And so that community partner piece was something that I remember members of the Root Causes Fresh Produce program were really thinking critically about. And also more specifically, what would we do, right? And as somebody who has not been in the research field, and specifically the community engaged research field as long, I remember we had a lot of conversations about what would it actually look like for our program to really take on a formal study and a capital R research study. And those conversations over time really amounted to designing or co-designing this study in order to undertake this research opportunity or this opportunity for research funding to actually determine whether or not the Root Causes Fresh Produce program could take on a randomized control trial study on specifically the delivery of fresh produce and pairing that with education sessions. At the end of the day, that's what we tried to do. And from the very beginning, it became clear that we knew we wanted to work with and make this a community engaged project. And specifically how we were going to do that, I know personally that it became clear that it was going to be with El Centro Hispano, but it wouldn't be without the foundation that we had from the beginning, of even as simple as knowing that we were sharing a van and providing resources to some of their community vaccination events. We wouldn't have felt comfortable to, I don't even know if I was there at the first call, but like, we're thinking about doing this research study. We're thinking of involving promotores from El Centro Hispano. Is that something that you all would be interested in participating? And I remember that was a very long process. Even before writing the grant, even before the letter of intent, if people know how far back these things sort of go. And also working with North Carolina Central University's dietetic internship program led by Dr. Lisa Best. The three of us came together, maybe not all three of us at the same time. I only really remember 2 or 3 times over the entire grant writing process that we actually sat down together. But trying to coordinate, okay, what are we proposing? What are we saying that we're going to do? What is this actually going to look like? How are we going to recruit community members into this study? How are we actually going to hire members of the community, the promotoras, for example, and we wrote that proposal, got it in, felt very comfortable with it. It got accepted in the summer of 2022. And then from there, it was just, well, what happens next? And I think what happens next, I'm going to leave a little bit to you all, but kind of setting the foundation of we, as a program, we're trying to figure out just how we felt like we could do this engagement. And really importantly, we wouldn't have felt that we could do this if not for the previous relationship that we had created, not from research, capital R research, but from just the provision of produce and being this liaison of resources that we wouldn't have probably engaged in this research in the way that we did and wanting to involve community members in the way that we did. And so I think in particular, the inclusion of community health workers was something that proved to be more of a challenge than I think we were expecting. And I would really love Ruby as really the person who had to coordinate a lot of that with us to speak more about what that experience was like at large.
I think one of the things that we didn't thought about it because it was so easy how we worked together before this research. It was the time consuming that it was gonna take, and we wasn't really prepared the promotores for what we were like expecting for them to do. So because we were so used to go out in the community, reach out, educate the community, and just bring resources, right? So and bring them into this program was kind of I'm gonna say hard for me because it was trying to understand a completely whole world especially because it was really more complicated to have this project running, because it took us a lot of time between trainings and waiting for the process and waiting for the green line to start. So we had plans in our minds. We had the plan to, oh no, this is gonna go really smooth and really great, and we're gonna have a great outcome. But when we really got to that point, it was complicated for the promoters to understand what their role was and also what we were expecting them to do, because they were ready for more. And I think that's something that we wasn't clear at the beginning. So it's something, and some of the lessons that we have learned, and we really appreciate, because while we were on the team, we were really they were really patient with us, and also we were really working really hard to get what the result they were expecting from us.
So I'll just add a little bit to the context that this study was an attempt of us to figure out how can we measure the value of the program that we're doing. And specifically here, we were looking at, are we helping with the heart health of hypertensive patients that were referred to us? And another reason why we wanted to work with El Centro, this was kind of a cool little tie-in, but El Centro's executive director, Pilar, had actually written a paper on a specific dietary approach to helping the Latino community. So kind of that was a cool little tie-in and a good indicator that I think they were going to be an awesome partner. But you know, as a student organization, we're trying to use this opportunity to demonstrate the value of what we think healthcare should look like at Duke. It's really relied on a lot of trust from all these organizations here. Also for CTSI and SERI to put their trust in a student organization. Like, yes, Dr. Hemming was involved, and I think he ended up pitching in a lot more than maybe he was expecting, but he really gave the students the opportunity to decide the scope of the project, the aims, how it was going to operate, and then El Centro had to trust us that this wasn't going to be just a huge waste of their time and that we weren't going to have this project kind of blow up in our face. And we did learn a lot of hard lessons in the process, but I think it really came down to people having that initial trust with us, and we're learning now how to use those opportunities of those hard lessons to continue to be a stronger organization and have stronger relationships. So just another big lesson learned from that project.
You bring up an important part that we talked about in the earlier panel about trust. I'm curious to see hear a little bit more what that looks like. So for the Fresh Produce program, when you're trying to work with partners, perhaps with Centro Hispano, how do you communicate trust? And Ruby, like when you want to work, perhaps you're approached by either institutions like Duke or students. What do you look for when someone wants to work with Centro and for you to trust them?
Well, to tell you a little bit more about me, I started as a community health worker at El Centro, so something I can give kind of experience, it's I was there with the community in first, hand to hear their needs. Something that I'm always looking when someone comes with a proposal or with a program that they want to, it's what benefits it's going to bring to my community, what benefits it's going to end up at the after the program ends. That's something that I always look for. And it doesn't matter how successful or not it's the program. I just want to make sure if it's something that is going to, at the end, is going to be beneficial for my community, it's something that I definitely want to go for.
Yeah, I can also speak to one particular moment that I think for me at least kind of brought this. I don't know if you remember this. This I really remember, but one day where Scott was, when we were really still formalizing the project and getting El Centro on board, particularly I remember Scott was like, let's go down to El Centro Hispano and talk to the community health workers. And I was like, yeah, sure, okay. And then kind of just explain the project and we get there and we sit down in the room with two of the community health workers that we thought were going to be the ones working on this program with us, or this study as we had conceptualized it. And I had noticed that while the community health workers that we were working with at the time were individuals that likely would be able to communicate in English, I realized and felt, especially from somebody who has to regularly interact with people who don't speak English, that they would probably want to hear this information in Spanish. And I feel like that was something that for me was sort of a turning point for me in really thinking about what this project meant. Because I took the effort, and I remember talking around a lot of words that I don't remember, but taking the effort to actually have the discussion with the community health workers themselves about what were we doing in Spanish, and actually explaining to them, hay dos grupos, grupo intervención y grupo controlar, y en ese grupo, like all of these sorts of things. And I remember one of the very first questions. First of all, me personally, I was like, I really hope they don't have questions. But they did have questions. And one of the first questions that they asked me, or at least the gist that I still remember, was one of the decisions that we had to make early on that was, I think, something that was a real limitation to our study, is that every person who got enrolled had to be a pre-existing patient in the Duke Health system. And that was something that we can get into if we want to, but in that moment, it was something that was really brought up as a point for them. Because from what I could tell, and also from what I have done in the work in this community, the reality is the majority of Hispanic and Latino identifying individuals, especially those who were probably a part of who we wanted to be in this study, were not patients of the Duke Health system. And so they are members of the community who may or may not be receiving regular health care from Duke Health, receiving it from Lincoln Community Health Center, receiving it from Samaritan Health, not receiving it at all on a regular primary care basis. And so that was one of the first questions that they asked me, was like, you mentioned that we're going to do enrollment from Duke Health, can we do enrollment from Lincoln, or just advertise it at some vaccination events or just general events going on in the community? And I knew that the answer was no, but I had to figure out, how do I respond in a way that actually is indicative of understanding of the context and actually developing trust. And I remember my response essentially being that at this moment, with what we're doing in the study, we have limitations that we can talk about as to why we can't do that. But at the same time, the hope is that we are able to, with this study, provide a body of evidence that we can bring back to funding institutions like Duke to be able to expand this beyond just patients of the Duke Health system. And the reality is, being able to have that conversation, that for me personally, this is not the direction I want this study to go, but is the way that we have to move this along, and helping them see that as well as people who are not thinking about these sorts of inclusion, exclusion questions from an academic, but rather from a personal and community-rooted point of view, I think was necessary to develop that initial trust and have this understanding that we see a vision beyond just what this study is. And I think another thing that I just kind of want to mention that kind of was a part of that, those two community health workers that we explained this to transition out of the study itself for limitations that were beyond any of our control, and sort of more broadly the funding of community health workers in North Carolina that probably Ruby would be much more equipped to answer than I. But the transition from them to two new community health workers was another thing that was unanticipated for running the study, and then developing their new trust as well, and developing their comfortability and feeling like they, in their own right, are coming from their own perspectives of what this study could mean, and thinking about what that was as well, is one of the multiple things that kind of made this study go longer than we had anticipated, but also was one of the tough lessons and conversations that we had to have in thinking about this partnership for this study.
Thank you so much. I think that's an excellent example, Ruby, of you having certain a certain threshold that you need to be able to work with someone, and having these questions that are necessary, and also enjoy the response from Elaijah saying, you know, being able to make those realizations as they're going on, adjusting and persevering and growing, right? Instead of giving up or saying, I can't learn Spanish or I can't figure this out, being transparent about, you know, the funding and having conversations like that. I think that really is important, and just great that you all had those conversations.
Thanks, Miguel. Yeah, before we move on to sustainability, I had one last question about the kind of daily operations, and speaking specifically about food. Like Saskia, if I might ask, for the Duke Campus Farm, you provide 40% of your output to root causes. How does that, if the crop doesn't, you know, if there's a failed crop, or are there challenges in making sure that you can reach that expectation on? Because I know each week you're providing food, and just also to Scott and Elaijah, how that the sourcing of the food, and how the expectations of the community of the type of food that they receive. If we could talk a little bit about that.
So just to clarify, the food that the Duke Campus Farm provides is actually a very small proportion of the tremendous work that Root Causes does. And we're very lucky that y'all are very flexible in terms of what you receive, and we have absolute confidence that you use it all in one way, shape, or form. We've had so many different iterations of this conversation over the years in terms of how the Duke Campus Farm might incorporate root causes more fully into our crop plan. And in terms of building trust, I think even within an institution, that kind of trust building is important. So being clear about what our limitations are in terms of our student and staff capacity, and how we might kind of weave our work with root causes into our mission as an educational farm. Also our financial limitations. So up until very recently, there's been an expectation that we basically sell produce in order to make the operating costs for our program, so not our staff salary. We have 3.5 full-time staff people who are paid by Duke University, but we're essentially covering our operating costs through produce sales, which limits then what we're able to give away. I'm very excited to say that expectation has now shifted. I think we've proven ourselves as an organization and proven our strengths really around education and mentorship, and it means that we are now at liberty to give much more of our food away. So I'm excited coming into this next kind of season of crop planning to be working with root causes to think about how we might be providing more of what they need. And even if we were to dedicate our entire acre to root causes, I think we still wouldn't necessarily be able to meet the demand of your participant population and the things that they need. So we're just sort of a small drop in that bucket, but excited to be so.
It is incredibly appreciated. But yeah, so the food that we get, about half of it is purchased using donations and grant funding that we receive, sometimes as a part of our research grant, other times just charitable foundations or things like that. We also, about 1.5 years ago, got a very nice gift of some funding from the outgoing chancellor of the health system. And that's kind of kept us going for now. So we're able to use that money to buy fresh produce. We also get a lot of good produce from the Food Bank of Central and Eastern North Carolina, and this might get into sustainability in one definition of the term. So we get a lot of reclaimed produce, seconds as they call them sometimes, from farms and grocery stores. So that's a huge support, and it's a huge support to have a huge vehicle to be able to move all that food. But I'd say, going back to the Duke Campus Farm, I think that in addition to the food that they provide, I think, and next to the enormous amount of encouragement that they perpetually provide us, their mentorship, especially starting out as a student organization that now finds itself, with staff, with faculty, with, a budget that is, kind of supported by the university on a guaranteed basis. We want to learn from that. How did those students figure out how to get organized and, leverage the relationships they had, or align themselves with what the direction of the university was going, or help direct the university towards a better direction. And I know you guys are still fighting some battles here and there, but I think we've really appreciated learning from you and kind of getting the strategy of how can our student organization that does not have any guaranteed funding, how can we get supported? How can we help ourselves kind of become more a part of the institution, which itself also brings in trust questions and a lot of soul searching and things that we also seek your help from, as well as our other community partners. But anyway, just wanted to underscore that and also reiterate, because a lot of people are really proud of the work that we do, but we are not funded. It's not a guarantee that this stuff just happens. So think of us when you're talking to the bigwigs around Duke. Things. Yeah.
I wanted to bring that up earlier when we were talking about challenges to this process. I think, to me, it's like 187 weeks of consistent service. That's a lifetime in terms of a student organization, and that consistency and longevity is kind of unheard of with zero stable financial support or any paid staff members. And I think, as an organization that evolved from a student-run organization and was able to kind of get a toehold into the institution, I think there's a period in the life of an organization like the Duke Campus Farm and maybe like Root Causes where that kind of grassroots student organizing is so compelling. And then I think there's an arc in that evolution where it starts to become exhausting. The turnover, the kind of navigating academic schedules, the graduation rates, et cetera, and I really sense your longing and even the sort of existential threat of particular people graduating and sort of seeing the future of the organization under real threat from where I'm sitting.
Gary, you were pointing on so many questions that are just about to come up. So on to sustainability. And this might be too much of a general question, but what does real long-term commitment to this collaboration look like? If we can just start with that super broad and then kind of maybe narrow it down. If anyone has some like first answers, what does real long-term commitment to this collaboration look like?
I think, we just concluded the study that Elaijah was sharing, and I think we're still kind of reeling from all of the work and effort that went into that. And I think to keep the collaboration with El Centro going, I think we need to find some time to catch up with you guys again and really talk about what went well and what didn't go well, and how we feel about how this last year went. And I think not be afraid to kind of put on the table the feelings that we experienced during this year, and figure out how we can grow and get better from that. I think Eric, your colleague, there was something that he had shared. I think there was one conversation that we had that was kind of difficult around budget and whatnot, and he really opened it up, saying that these tough conversations are opportunities to grow and get closer. And so I think that's a big thing that we need to come back to. I think we had also come out to El Centro most recently because of this funding opportunity that required to have a community partner. I think we need to make a commitment to continue to ask, how can we be helping you guys or supporting you, and not always when there's funding attached to it. And I think we have to look at our own system, see what resources do we have available to assist our partners, and make those known to folks, which is challenging to do because we have these existential threats that the scarcity mentality makes us think, like, how can we conserve our resources? But if the stories that we've been sharing is any example, it's like that trust, that going and lending a hand to other people is really the way that we've been able to accomplish so much and be able to persist. So that trust, that confidence, I think, is something that will really be imperative to keep this collaboration going and to improve.
Also, I think something that is gonna keep us together is that both organization has the same mission, and it's to serve the community who needs it. And I think it doesn't matter, how hard it's gonna be, because we're, like Esco was saying, we learn a lot. And yeah, there were times when we were like really exhausted, and especially when he was mentioning Eric is like my supervisor, right? And he brought to me difficulties and what are you guys like doing with the times and the promotores and all this tough question, and I didn't have the right answer that he wants to hear. It was really complicated for me to, be that person in the middle. So, but besides that, I know that we want to serve our community. I know that we want to help those who need, and it doesn't matter like if we have funds or no, we will find a way to keep working together.
And I would say, when I was just thinking back on Julian's, so one of the first 5 medical school students who brought this organization together, his participation in our program, I think one of the pieces of that conversation that he brought and that we kind of held as a program was a real dissatisfaction with the food charity model. And I think one of the reasons we really appreciate working with root causes, and I think why partnership feels really durable, is a kind of an understanding that the inequalities within the food system are systemic, and that the solutions also need to be systems-based, and a shared recognition that systems-based solutions are going to be things that where there areas where there's friction and things that don't work out, but that we need to be persistent and approach these problems from many angles in order to make headway.
And if I could just offer sort of something that ties all of this together, and it's just sort of like the word that I think of is trying to figure out, if we think long-term about sustainability, how we keep ourselves accountable and how do we keep the partnership accountable to each other. I think that accountability question in particular is something that I grapple a lot with in the Fresh Produce program because of our moniker as a student organization. And one thing that I always bring up, especially in a service learning context, but more generally in thinking about our ability to stay accountable, is what it takes for us to actually keep going 187 times. How do we manage the summer? How do we manage the breaks? How do we manage what happens when students aren't here, but El Centro wants support for a holiday event, for example, right? Like, I think that's still something that we have to grapple with when we think about how to actually continue this. And I think, for example, with this study, the timeline that we ended up having to work with was that it extended from April to June 2023. And a lot of the students on our team had other plans, right? They had another place to go over the summer. They didn't anticipate that the study was going to go on that long, and that was a difficulty that sort of was felt accountability-wise by those running the study from our end. So I can't imagine. It was hard for me to figure out how do we then transpose that to our accountability to El Centro Hispano and to the North Carolina Central University dietetic program as well, and actually being able to deliver on what we had discussed months ago when the students, through no fault of their own, I want to make that very clear, but had other plans, didn't anticipate us needing to go on this long. And then moving from reflecting on the study to more thinking generally about these partnerships, I think we have created a brand as a student-run organization, or maybe student-started organization, but I think really critically as well about who are the people who can keep this running day to day when the students are in class or when the students are not available. Like, the reality is a lot of things have fallen to Scott, for example, and fall to people who can be available when the community calls, whether it's picking up our food from the Food Bank of Central and East North Carolina on our standing Friday morning appointments, or being available when El Centro Hispano has an event and needs something in a weekend when students like myself already have made plans. And so it's thinking about these tough conversations, but also as embedded in those conversations, how do we keep accountable to each other and develop that trust in the long term? I'm not sure. I'm myself and skeptical about keeping like students at the forefront when in order to do these sorts of produce deliveries and just generally like service, it's not something that can stop when students leave or can stop when the study ends, right? Like Scott said, we still need to reflect with El Centro Hispano what did this study do for all of us. But beyond that, what are the ways that we can support each other and make sure that our mission and our team are supporting each other, and it's not just one or two individuals. That's another thing that I think is not the easiest thing to figure out, right?
I have another question for you, Elaijah. Just same question we were just answering, but I'm curious about like how do you see root cause to the extent that we continue to have students involved and still have the, maybe it's not student run, but it's, still keeping with the ethos of students kind of providing the pressure or providing the direction for our organization. How do we continue that collaboration? How does root causes, if it becomes institutionalized, how does it continue to be a place that attracts students like yourself who has, not only bringing expertise and experience, but like a passion and a sensitivity to different kinds of needs that we just didn't have. And from the outside looking in, maybe like we don't have it, but from the outside you may have. How do we attract people that have things that we don't have?
I think some of that is not going to be something that you can just say is going to happen, right? I think being able to have our foot in many doors from the institutional level is what allows students to be drawn in. But I think beyond that, I think in summary, passion begets passion. And I hear this from our internal team conversations that we influence each other in this work. And in turn, seeing, especially as new students come in, like them being able to see that we are doing this work, but are doing this with these perspectives in mind, begets these opportunities and begets people seeing that this is something that they can be a part of. I think, for example, it can feel pretty out of touch. And that's one of the things that I hear a lot from undergraduate students in particular and their interest in being involved in root causes in the Fresh Produce program, that you talk, I hate to say it in this way, but you talk a big game in classes. You talk a big game in the academic space about what it means to do service and what it means to be embedded in a community. But then it kind of stops, right? Very rarely, in my opinion at least, are there these very specific opportunities in which you can actually develop authentic opportunities and conversations and enter spaces that you often don't have. I speak with people who are my grade and are also seniors, but they are not engaging in communities in the same way as me. And I think a lot of that is tied to the partnerships that we've developed and are still working to develop. But I think that also comes from the uniqueness of our program and being able to provide those opportunities and being very forward with that. I think another thing that's scary for me sometimes is that the decisions that we are making as a student organization quite literally will lead to a member in the community having access to food. And the reality is some students, especially some who engage with us for one or two times, are not fully recognizing of that and recognizing of the weight of that and are equipped from their classes alone to process what that means. And I think root causes provides that opportunity for students to get that exposure. And as I think long term, one thing I really want to think about and am sometimes fearful of is how to make sure that what I personally prioritize, for example, in community engagement, in thinking about what we're doing is not just service procurement, but community development, is something that is not easy. And I think root causes and our partnerships with El Centro Hispano and the Duke Campus Farm provide that, but is something that still that attracts me and has, to my knowledge, attracted other people, but hopefully attracts the right people to keep this energy going. So I hope that somewhat answers your question and it's not just musings on the future, but to me is more my perspective on where I hope things go from here and how, from my view, students view the potential for these partnerships.
Then before we have our last question, and then we want to open it up to the audience. Scott, I'd love to actually hear your kind of response to your own question, because as the kind of quote unquote adult in the room, you're unpaid for the labor you do, and you come with a big passion and you're very invested in the whole program. But if you could answer your own question about that, thanks.
So I think definitely learning to rely on other people, I think when you say answer my own question, what was my question again?
When you asked Elijah about how to like that kind of ephemeral, like that passion that Elijah brings to but as you institutionalize, how do you make sure that that can still be recreated, or what might potentially be lost in the institutionalization?
Yeah, I think what we're trying, our theory for how to keep it going is kind of, in a short form, is kind of making all the folks in leadership within Root Causes replaceable, in the sense that we are enabling ourselves to be able to hand off the responsibilities that we've kind of taken on ourselves and teach new students or new community members coming in on how to accomplish those different tasks. And that enables us to develop more relationships, to find more like-minded people, to just the satisfaction of having some know-how and being able to pass that on to someone else really makes it gives me energy. Sometimes being able to unload some of those responsibilities also has its own benefits. My partner just left earlier. She's really appreciative that not everything is falling on me now, and that I have more free time to invest in myself and in those kinds of relationships. But also freeing up those responsibilities allows, I think, all of the leaders within Root Causes to think about new things that we want to bring to the program. So that's the theory right now of how to do it. Just as an example, on a given Saturday, we have about 45 to 50 volunteers that kind of come through, between the 15 or so that are packing the food, the 15 or so that are delivering it. So there's just this constant cycle of about 40 new faces that we meet every week, and that's also kind of uplifting. But from those 40 that we see every week, we try to encourage them to take on more responsibilities. And we have within Root Causes leadership, we have 35 students that have kind of committed for a full year to help us with various aspects of our responsibility. And for a student organization, our org chart is like crazy, which is awesome that so many people have wanted to dedicate their whole year to help develop something. And that's also just exciting to see that we have this momentum of people who see something in what we're doing, that they want to spend their time with us. And that kind of, as much passion as we're putting out there that is attracting students, as Elijah's saying, when they come and bring that passion, it gets us excited again too. But yeah, that's the theory.
Perfect. So to wrap up, can you each tell us how people can get involved in each of your amazing organizations and what we can do to help?
So tomorrow is 188 week. We are at the corner of North Mangum and Gear Street. You can meet us there at 8:30. You don't have to sign up, but once you come the first time, we'll show you how to sign up so we can keep pestering you to sign up again in the future. But that's probably one way. Come rain or shine.
Well, many of you may know or may hear about El Centro Hispano, and we are on the Lakewood Shopping Center in Durham, so you can come by and visit us anytime. Or if not, we can meet at any of the neighborhoods. As you may see on the picture, we have a little mobile unit that goes around the neighborhoods, visiting those community bringing them to health screenings that they may need. You guys can visit our webpage where you can find more information about how to support. One of the things that we are always looking for is funding to support the CHW programs. And also right now, my department is looking always for vaccines, free of cost. So if anyone has a contact, it's something that I will really appreciate.
We have open community workdays every Friday. They're actually happening right now, 1 to 4 p.m. It's an open gate policy. There's a potluck the first Friday of every month, including this Friday. You're welcome to head on over to the farm. It's 4934 Friends School Road, directly across from Carolina Friends School. Maybe more directly related to this panel, we're going to be hosting a charrette early in the new year, so a sort of collective strategic planning process around the future of our community food security efforts now that we've been kind of released from the bondage of CSA. So if anyone's interested in participating in that or finding out more about that, feel free to email me. Probably the easiest way to remember that contact information, if you go to our website, it's just farm.duke.edu. You can find my contact info there.
I think echoing a lot of the ways to get involved with the Fresh Produce Program, as Scott already mentioned, the only other things that I would specifically mention is that we are opening or just recently launched the Root Causes Undergraduate Coalition for undergraduate students interested. And my hope is that the energy of that club, one, allows us to secure more funding from Duke to be able to support undergraduate student efforts. But I think more importantly, energize undergraduate students to be thinking about undergraduate specific concerns. The med students in particular come at this from much more of a clinical perspective and really thinking about those angles. But I think undergraduates come with a different set of values, especially with their backgrounds and still reflecting on themselves and where they came from. Not to say med students don't do that, but I think the energy that I feel from undergraduate students is that there is a lot more thinking of real world applications and really seeing themselves as a part of that. So my hope is that for any undergraduate students or those interested in that lens, really engaging with that as well. So that's the only thing I'd add.
Okay, so we have about 15 minutes for questions, and we'd love to open it up to the audience. Ooh, it's a bit bigger than I thought. Any questions? Perfect. Do you mind using the... And if I know you've already introduced yourself, but just in case.
Yeah. So my name is Liliana Marin. I work with the American Heart Association. I'm their Community Impact Director, and I'm a former Duke employee too. And I happen to know both organizations, Root Causes and El Centro Hispano, very well. We're current partners, and prior to my time with the American Heart Association, I used to work at the Division of Community Health at Duke, and I am very proud to say that I happen to also know the founders of Root Causes, and I remember them planning this whole program. So to be here today, years later, and to see everything that they have accomplished, let me tell you, it goes beyond my dreams, because I remember those initial conversations, and it was pure passion that was driving the students to make sure that they were doing something for the community. So today, to stand in front of you, Elaijah and Scott, and to see and hear everything that you're saying, it makes me very sad to know that whether it's Duke University or the Duke healthcare system, that they haven't supported the program. It really is disappointing to me as a former employee, as a current community partner, and as a community member, because I have seen the work that you guys have done. So I really hope that this information and this session will encourage all of us to write a letter, come together as a community, because they are really making an impact. And El Centro Hispano, they have been serving the Latinx community for over 30 years. So once again, just a very proud community partner, and I can't wait to see where else you guys are going to take this work.
Thank you so much. I don't know if anyone wanted to respond to that really beautiful statement or clarify. I mean, I think that this was one of the issues that we talked about when we all came together about where is that Duke role within this collaboration and that support. And we don't have to go into that right now with our last remaining minutes, but if anyone wanted to respond.
Liliana, thank you. You nailed the lines. No, thank you for saying that. And we'll have to go back and tell Julian about what we've done today. I also say, in fairness to Duke, we haven't made very many asks, but we are getting ready, kind of getting our campaign ready to really make some big asks of the university and the health system. And I'm optimistic. I think they have. They're really keen on being, I think, a part of the community, and there's been some good momentum. So it will be sad. It is sad, I guess, that we haven't, stumbled upon big bags of money yet, but maybe.
Hi, Minna Silverberg from Syrian Community Health and so forth. And yeah, partially want to echo what Liliana is saying. I mean, this is an amazing organization, and I think it's, it's worth pointing out that you have already been through, right, leadership successions. Julian and others have gone on, and you have survived, and also that you do so much in addition to the food work. I mean, we haven't even, right, the housing and all the other stuff that you do. It's incredible. My question goes back to something that Saskia said, which was about trying to move away from the food charity model and towards more of a systemic approach. And I heard you say, for example, that you work with minority-owned farms, which I assume is part of that. But I'm curious to hear in what other ways you are trying to take a more systemic approach, not just trying to get food to people immediately, but deal with some of the systemic issues.
You want to take it, Elaijah?
I can start. I will say that this is something that we are not doing the best that I think we could be. I think one thing that we are still sort of grappling with sort of more broadly that I promise is related to your question is the extent to which we still operate under this COVID emergency mindset. I think the delivery model that we still operate on today, and even still within the context of the study, was still within this context of COVID is still a thing. People are still in immediate need. We need to be getting things out in a service procurement and address a much more immediate thing, right? And so we are still, I think, maybe mentally in that space. And as we count to 187 and 188 and so on and so forth, I think we still operate under I don't want to say food charity because I think conceptually that's not what we're doing, but I think we are not yet at the stage where we are truly addressing systemically in the way that we want to be. I think our research and quality improvement tried to be an iterative process in the actual delivery of our produce, and for example, what exactly is the produce that individuals want. But while we've only started to broach the questions with participants, for example, of need, one thing we haven't specifically mentioned yet in this panel is that Basque Connection team that was started in 2021 was re-picked back up this past year with me as the only person in both. One of the pictures has been cycling through there that I added, that is trying to start to unpack that a little bit more by thinking more about some of the other food security policies and practices of SNAP and WIC and other government assistance programs. We know that we are not the only game in town when it comes towards actually the roots of providing food to people, but there are ways in which we are unique, and I think just now with some of the partnerships that we as a program are doing in the policy space, are we actually starting to unpack how can we reimagine not just food, but reimagine what it means to be in community as it regards food. I think just now are we really starting to think about it. For example, is it a good thing if someone has been with us for all 188 weeks of our program or not? What does it mean if somebody disenrolls themselves from the program of their own choice? of their own choice. I'll put it in quotations, actually. Does that mean that they have developed their own means of self-sufficiency? Or does that mean that they have developed this mind that they are no longer deserving of that food after X number of weeks? That's the reality of some of the conversations that I personally have had with individuals in making those delivery confirmation calls. And I think more broadly, that is not something that we have yet truly begun to unpack as a program, as we still try to figure out the logistics and the operations of actually being able to develop in a separate question of scale that we haven't even begun to address. So I hope that is just a little bit of my perspective on that.
Can I just say again in a different way? I think the other thing that it's so easy to forget when you're listening to students like Elaijah is that this organization is run by students. So there's a strong educational mission that's built into the DNA of Root Causes as an organization that I think is systemic, right? They're training medical students, MPP students, undergraduate students to bring this systemic food systems lens into the work that they do. And that, I think, in its highest or best sense, is one driver of systemic change.
Yeah, so I think for the advocacy part of our program, and hopefully proven by some research that we may be able to do, like I think we're also really trying to demonstrate that preventative health care is something that can be invested more in for our patients. You know, with nutrition-related illnesses, a lot of them are chronic and so long, and they're expensive. So if we can kind of help nip some of these things in the bud, that may help avoid kind of the downward spiral of increased healthcare costs, contributing to further, you know, making it harder to purchase food, making it food insecure, and then, you know, the whole cycle continues. So that's another thing. That's kind of like the big lofty thing. I think Saskia, definitely with education and you know, whatever impact we can have on the students that come through our program, or community members, or faculty, I think that's kind of our piece of the puzzle. I think we're as we think about systemic change, I think we're trying to figure out where in the system we exist right now, and you know, where can we make the most strategic investments with what assets and resources we have, and there are many. But I think, yeah, that's what we're doing so far. But it's a good question to keep on asking ourselves.
I mean, I think we all struggle with this, right? I mean, just to say, you know, when we were talking about justice and equity and community engaged research, I think for all of us, there is this like pressure to meet immediate needs that can make it really hard to, and also, as you say, the other is like super complex, right? So that combination of the pressure and the complexity of the other, it's a constant challenge for all of us. So I was mostly asking because I was hoping you would say things that would inspire and educate me, and you did. So thank you.
Other exciting things around food, if I can just like, so the university and the healthcare system is hiring a new food security coordinator. That's a big thing. You know, so there's going to be some leadership thinking about how those two systems can be coordinating and working on that, and also including screenings for social determinants of health is going to become a requirement for healthcare systems. Not in this coming year, but you know, it's not going to address those problems, but it will highlight them and identify them. And yeah, so those are some other kind of hopeful signs that the system is changing, at least.